The risk of tuberculosis in Ghana remains high, although curable. In 2015 alone, we're told that Ghana recorded 76,005 TB cases. Here's a News Desk report.
Tuberculosis is a contagious bacterial disease caused by Mycobacterium tuberculosis. TB mostly attacks the lungs, but it can affect any organ of the body. Although TB that affects other parts of the body is not as infectious as TB of the lungs. Pulmonary TB is transmitted from a sick TB patient as a droplet infection through coughing, singing and sneezing. Inhalation of these droplets by an uninfected person may cause infections. Adults in most parts of the developing world, including Ghana, have been exposed to TB bacteria without knowing, resulting in TB infection. Those at higher risk of progressing to the disease are smokers, alcoholics, people living in overcrowded and poorly ventilated rooms. Also included are mine workers and persons with lower immunity due to medical conditions that, notwithstanding, TB is preventable and curable. Diagnosis and treatment is available free of charge in all public and accredited private health facilities. However, people hardly seek medical attention due to stigmatization.
You're still watching Midday Live, and we're looking at tuberculosis in Ghana. And we have some incidences of tuberculosis here in our country, Ghana. At the end of the year 2015, we had 76,095 people who had tuberculosis, and 44,524 contracted this very disease, and 9,714 people died of tuberculosis in 2015, and these figures came at the end of the year 2015. Let's move on to other statistics we have here. And every day we're told that 122 new tuberculosis cases develop, and every hour we have 27 people dying of TB, which is tuberculosis. 5 people get tuberculosis, and then we have 1 person dying of tuberculosis every hour. Let's look at more and the impact of tuberculosis on the nation at the end of 2015, and that's the amount and the figure here and the population that has been affected so far. This afternoon I have been joined in the studio by the Deputy Program Manager, National Tuberculosis Control Program, and he is in the person of Dr. Ninote Hansen. Note. Good afternoon, Doctor.
Good afternoon.
And thanks for your time.
Thank you.
I just went through the figures for 2015, and we are in 2017. I'm sure it's shot up.
Well, these figures are estimated to be based on the estimated prevalence of the disease annually. And so at any point in time in the country, if we are not doing significantly to reduce these numbers, yes, the numbers will surely go up.
So let's take a look at probably for 2016. Do you have that figures available?
We still use the same estimates because we are actually reducing trying to reduce the numbers that are there. But based on the national prevalence, it's estimated that about 76,000 every year exist within the country.
Which is quite worrying.
Which is very worrying for us.
And what is being done about it? I'm asking because some years ago, you'd see posters of tuberculosis all around. Just to remind you, there were television adverts, radio adverts on tuberculosis. What happened?
We haven't stopped whatever we are doing as a National Tuberculosis Program. We are still working on our strategies. We have actually spent some time trying to relook at what we've been doing and to re-strategize and put in place newer strategies. So for 2017 and moving forward, our focus is to do a lot of active case finding within communities, and then what we call also intensified case finding within health facilities. So we go into in any health facility, once you have a client coming forward for health, to seek health care, we would actually take the opportunity to ask them about cough and other symptoms related to tuberculosis. The whole idea is that we want to actively find these people who may be having symptoms because we recognize that a lot of people would not necessarily come to hospital and come and complain about a cough. We also know that the disease, because of development, because of improvement in health status of Ghanaians, a lot of people will not necessarily come down with severe disease. And so the strategy now is for us to take the opportunity to look out for TB cases amongst people who access healthcare facilities. And also, once we do the outreach services, we'll take the opportunity to find TB among people who are vulnerable. Various population groups are vulnerable, like minors, people engaged in galamsey, people in urban slum areas. We'll take the opportunity to find TB amongst these people, because a lot of them will really not come to hospital. Okay,
but quickly before I let you go, we're going to celebrate this day, and you mentioned what you are doing. What can society do to help curb this?
Society needs to do a lot of acceptance. We need to accept people who have tuberculosis. Stigma levels are just too high in Ghana. Somebody has the disease and everybody runs away from them. But if you're living with somebody and they have the disease, they would have infected you even before they got diagnosed. So the fear of knowing that they would infect you after you now know they have the disease really doesn't help us. So what we really want people to do is to accept the average Ghanaian who may have the disease and to help us to find even more people who have the disease. We are also going to do a lot of education. We're going to do a lot of screening activities with, we have these mobile X-ray containers, which we are placing in various facilities around the country. And we're also going to be doing outreach services. We want people to come forth to know the status of their lungs. We'll screen them, and then when we find this problem, we will diagnose TB. Thank you very much, Dr. Noti Hansen Noti. He is the Deputy Program Manager, National TB Control Program. We're looking at tuberculosis in Ghana.